Hello and a very good afternoon to each one of you. Welcome to another empowering edition of the Vibe Live, a Hexalog. On the occasion of World Health Day, which is celebrated on the 7th of April, today is indeed a special episode. Talking about the Vibe. The Vibe is a platform dedicated to fostering women's excellence. It stands for Women Inspire, Build, and Enhance. It brings together women doctors from diverse specialties to share knowledge, leadership experiences, and personal journeys that inspire both growth as well as collaboration. There are four fundamental pillars that form the Vibe: physical well being, mental health, financial wisdom, as well as professional excellence. Through various initiatives, the Vibe strives to build a strong community of women professionals who uplift one another and redefine the landscape of healthcare leadership. I'm Dr. Ritu Johari, consultant diabetologist and metabolic expert practicing in western suburbs of Mumbai. I have a unique, diverse background with decade and a half spent in pharma industry and now since last half a decade practicing diabetes, thyroid, and obesity. Besides clinical practice, I contribute to research and medical writing. But what brings me the most pleasure in sharing is the introduction of this exclusive initiative, The Vibe, which is one of its kind platform targeting fostering women excellence. I'm blessed to be complimented by my husband, who's an orthopedic surgeon, and our family feels complete with a teen son and a toddler daughter. With that, let me introduce you to our team Vibe. And before that, a very warm welcome to our speaker for the day, Dr. Sheela Nambiar. Welcome,
You.
ma'am, to the Live Hexalog.
Thank you. My pleasure.
Dr. Lutika.
So, so I'm Dr. Latika Purohit. I'm a diabetologist and a lifestyle medicine physician practicing in Kolaba, Mumbai since the last 3 decades or so. I'm also the visiting faculty at the JJ Group of Hospitals, and I'm part of the National Executive of the Research Society for Study of Diabetology in India. I have been the chairperson of the Maharashtra chapter earlier. I'm a Rotarian and a past president of the Rotary Club of Bombay Midtown. Besides this, I'm a partner with Sugar Doctor, which I run with my husband, Dr. Suresh Purohit. I'm a mother to an artist and an entrepreneur. And what gives us a lot of happiness is this afternoon conversation that we have with star women achievers who are physicians, who have been trailblazers in their own way and have created, a very nice environment for all other women physicians to be able to go forth. Besides this, I thoroughly enjoy traveling and enjoy eating good food. And of late, the recent thing is to cook without using oil, which I have learned in my connect with Dr. Sheela. Now I hand over to Dr. Pranjali Shah for her introduction.
Thank you, Dr. Lotika. So I'm Dr. Pranjali Shah, Director and Chief Diabetologist at ACT Diabetes Clinic. It's in Mulund, Mumbai. ACT stands for Awareness, Prevention and Treatment of Diabetes. So apart from treating patients in the hospital, we believe in creating awareness. So we do a lot of community awareness camps. In that, we have screened more than 25,000 patients or people in central Bombay. And if you don't find me in my clinic or doing these camps, you will see me doing farming on weekends, spending time with my pets, doing hiking with my boys. So that's my time where I get joy, and that's to relieve from the stressors. And this every Wednesday we love connecting with inspiring women like you, ma'am. And this is an amazing time we spend together. So it's like direct heart-to-heart communication from each other. Dr. Rukia, over to you.
Hello, ma'am. Welcome to the Vibe. I am Dr. Rukia Surya Sheikh. I'm a diabetes, thyroid, and an obesity specialist. I have been practicing in Mulund for a decade and a half. And this journey has taught me that healthcare is not just about treating numbers, it's more about understanding people. And so those are the conversations even in my clinic And these are the beautiful conversations which I love over here. So when I'm not in clinic, you'll find me working out, playing carom, and this good company and meaningful conversations that make you think and also laugh. And lately, I have started painting, my way of adding a little color and calm to the chaos of the daily life. I'm truly excited to be here today among all these inspiring women in medicine to learn, to share, and to grow together. Over to you, Dr. Kavita.
Thanks, Dr. Rukia. Namaskar, everyone. Namaskar, good afternoon, ma'am. I'm Dr. Kavita Rane. I've been practicing diabetes for over 15 years now at Chembur. I'm the Chief Operating Officer at Rane Hospital in Chembur. I also practice at Apollo Spectra in Deonar. Along with diabetology, I love educating people. So we have camps at our hospital. I love communicating with the community and making our hospital as a part of this community. So being on Vibe, I have learned so much and I have interacted with such wonderful women doctors over the past so many months. And with the overwhelming response we got for our Vibe Connect, which was a physical meet we had, it has been amazing journey to travel through this on this forum. Apart from that, I love drawing. I love abstract art. I love to visit galleries. I love travel. I've had a photography exhibition and various other creative opportunities. But thank you so much, Vibe, and over to you, Dr. Rukia, Dr. Ritu.
Thank you so much, girls. So, talking about today's theme, women need more than treatment and cure. This is actually a mantra to holistic wellness by our great speaker. And this is the spirit which points towards health beyond medicine, which is a hint at lifestyle medicine. Like I said, on the special occasion of World Health Day, we thought that none other than somebody who believes, breathes, and practices lifestyle medicine would be a good pick for the vibe. So, for you, dear audience, here is the trailblazer woman who's an excellent academician, an OBGYN practitioner, a lifestyle medicine expert, a fitness consultant, an author, a TEDx speaker, an entrepreneur. Oh my God, so many hats, not only worn but aced by one woman. Welcome to this week's Vibe Hexalog with Dr. Sheela Navyar. And may I just take your permission, ma'am, to speak few lines about you. So, Dr. Sheela Navyar, born and brought up in the Nilgiris, is a third generation physician, schooled in OT, undergraduate at Madras Medical College, then her postgraduate degree in OBGYN from Kasturba Medical College, Manipal University, Manipal. She's also certified as a fitness and lifestyle consultant. She came back to Nilgiris to join her mother, Dr. Indra Nambiar, who's also an obstetrician in the family-owned hospital, which is Parvati Medical Center. Besides her OBGYN practice, she founded a program called Training for Life for chronic ailments like obesity, diabetes, depression, PCOD, etc., using various lifestyle modalities like exercise, diet, sleep, stress, and psychological counseling for behavioral change. She's also board certified as a lifestyle medicine physician from the British Society of Lifestyle Medicine and certified in positive psychology and cognitive behavioral therapy. As a pioneer in lifestyle medicine in India, she is one of the founders and past president of the Indian Society of Lifestyle Medicine, also known as the ISLM. She is also a speaker at the TEDx, at various national and international conferences, and also the author of three best selling books that Get Size Wise, Gain to Lose, and Fit After 40. I'm sure we should all read them. So, with that, a very warm welcome once again, Dr. Sheela ma'am. And just a quick question. How did you feel when you received the invite to be on this hexalog?
Excited. Excited. I've heard about it. Latika's been mentioning it in our ISLM group. So it was really nice to receive an invite from you. I'm privileged. Thank you so much for having me.
Thank you so much, ma'am. Lovely to have you. With that, without further ado, let's begin. Dr. Lotika, over to you for the first segment.
Yeah, thank you, Doug. So the first segment talks about the journey and the turning point. I know my turning point was when I heard you on one of the webinars a few years ago, and that's when I was very curious to know what is lifestyle medicine. Is it a specialty, and what is it, and what does it entail? And so I just wanted to know, you started off as an obstetrician gynecologist. What made you shift your lens towards lifestyle medicine? And was there a defining patient experience that changed how you practice medicine?
Thanks, Latika. I didn't realize that I had influenced you through a webinar. That's indeed a privilege, and honestly, that's what has really kept me going. Influencing other physicians to also practice, or at least include lifestyle into their practice. So, regarding your question, it wasn't really a patient or a specific incident. And neither did I shift my focus from obs and gyn. It was more like I included lifestyle into my practice. And the what got me thinking was actually in my postgraduate days in Manipal. They had a beautiful library, and they had a whole lot of different, not just medical books, but they had a whole lot of other books on philosophy and psychology and so on. And I remember a quote by Thomas Alva Edison, which said, "The doctor of the future will not give only medicine," I'm paraphrasing here, but will interest his patients in the human frame, in nutrition and in prevention. And it got me thinking, because we hadn't really thought about health in that, with using that framework. As you know, in medical college, you're taught about symptoms, disease, diagnosis, treatment, investigations, and so on. So I did go back and start a regular OBGYN practice. My mom already had the practice going for 20 years. I joined her and started practicing. But somewhere along the way, in the first year or so, I kind of realized, I'm not really happy just treating symptoms. I can't do that. I said, I can't just treat, back pain and the common gynecological and symptoms that women come with. So I started looking at other ways in which we can feel better. Basically, that was my objective. How do you feel better? And I know that each lifestyle medicine physician comes into it from a certain point of entry. So for some, it's nutrition. For some, it is their own health, that, whatever health problem they had that got reversed. For me, it was exercise, because I was an athlete in school and I was very passionate about exercise and fitness. And I know that exercise for me was not just about the physical. It was very much about the mental and emotional. My day without exercise went very differently from my day with exercise. So I certified as a fitness consultant, and then started teaching classes to women, and started introducing exercise into my prescriptions for women. And it started with that. And then, of course, there was nutritional counseling. Earlier, it was just very basic nutrition, what we knew, what little we knew, and from personal experience as well. Counseling, psychological counseling, was very much a part of my practice right from the start, because I was very interested in the human mind. And in fact, I think I would have chosen psychiatry rather than OBGYN, but for some reason I chose OBGYN. So I'm very interested in the human mind and why we do what we do, why we behave the way we do, the kind of biases we have, why do we hold those biases, etc. So, and I know that that plays a very important role in behavioral change. Without that, you can't really change behavior for long. You could for short periods of time, but you can't do it for long. So, yeah, that was a long-winded answer to your question.
Yeah, it's interesting to hear about the journey. And I know lifestyle medicine wasn't popular then.
Yeah.
And so did people question what is your approach?
Yeah, well, it wasn't that it wasn't popular. It didn't exist as lifestyle
Didn't
medicine.
exist. Yes,
Yeah,
that's
it was
right.
only after 2015 or so that it actually became a separate field. So I wasn't practicing lifestyle medicine per se. I was just including things like diet, exercise, counseling, etc. into my practice. And yes, I had a lot of, how shall I put it? I had, especially physicians, a lot of raised eyebrows, because I mean, I'm talking about the late 90s. and early 2000s, right? So, what is she doing teaching exercise? What is she doing prescribing what to eat and what not to eat? Why does she spend so much time talking to the patients? Things like that, right? But what really kept me going and motivated was the patients were took to what I was doing very, very eagerly, because I think they felt heard. So it was more from the patient's perspective, despite the, I wouldn't say pushback, but curiosity and surprise from other physicians. But of course, now there are so many physicians who are taking lifestyle medicine, embracing it as part of their practice. So it's come a long way. It's come a long way.
Oh, yes, it has. No, I know. I remember hearing about the exercise prescription first time, and I was wondering, I said, oh, we have a prescription for that too.
Yeah.
And it was very interesting to understand, because as a diabetologist, all I would tell my patients were to exercise.
Yeah.
But there was no specification. And then once I did the certification, I understood the fit formula and things like that, and, it's so much nice, better. So looking back, what was your biggest learning in the early years?
I think it was more of a confirmation than a learning. It was for me. It was so gratifying to find patients really trying to incorporate change. And that it is possible. We kind of underestimate what people can do and people are willing to do.
Oh, yes.
So, and most of my patients in the Nilgiris were rural or semi-rural. So if they could incorporate exercise and change their eating habits or change it to some degree, because they were already eating quite healthy, I thought to myself that this is not an impossible task. Right? It's about addressing it in the right way. So for me, it was more about confirming that lifestyle change is possible and that it will bring about positive change.
Okay, that's so nice to hear. Now I hand over to Dr. Kavita for the next segment.
Thanks, Dr. Latika. Good afternoon, ma'am.
Good afternoon.
It was amazing to hear your story through what you answered with Dr. Lotika's questions, and how it has changed your life as well as the life of so many others. So, you strongly advocate lifestyle as the foundation. What does that mean in practical, everyday terms?
So lifestyle lifestyle medicine explains the 6 pillars of lifestyle, right? Nutrition, exercise, sleep, stress management, avoidance of harmful substances, nicotine, alcohol, etc. And of course, one of the most important is social connections or relationships. So using these 4 pillars, we recommend a change in trajectory of health, using prescriptions for each of these pillars. So lifestyle, of course, can actually be many other things, including your financial status. Like you said, vibe includes financial health as well, which I think is extremely important. So financial, psychological, and all of that. And lifestyle medicine does include positive psychology as part of its curriculum, and we use positive psychology in all the pillars. So these are the 6 main pillars, but I would think financial health, environmental health, even spiritual health would definitely should be included as part of the lifestyle modalities.
True. It is like a holistic approach to health itself, to living.
Yeah.
That's amazing. So, ma'am, if you had to simplify health into 3 non-negotiables, what would they be? How do you make lifestyle changes sustainable rather than short-lived?
3 important pillars, or the most important, I would think, would be nutrition, movement, and can I give you 4? So nutrition, movement, sleep, because you need recovery, and I think relationships. I would think they would form the core of the non-negotiables in lifestyle, in your lifestyle habits. And what was the second question? How do you
How
keep
would you make lifestyle
sustainable?
sustainable rather
Yeah,
than
that is hard, isn't
short-lived?
it? Yeah, that is hard.
Very
It is
hard.
very hard because you see, it's not, we think it's just about behavior. And yes, it is behavior. That is the lever through which you make the entry point. But actually, it's about changing the identity of the person, or rather, helping them change their identity, which means like if you had to say something like when you introduced yourself, you said that you exercised, and so you consider yourself a person who exercises. That is your identity. So you need to move the trajectory of the patient's narrative, self narrative, from just someone who maybe wants to exercise to lose weight to someone who exercises. There's a huge difference. So when you do that and when you help the patient do that, they tend to sustain it better. And if they can say, for instance, you see, like if you think about diet and nutrition, when somebody says they are vegetarian or they say they are vegan, that's their identity, and that's why they hold on to it so closely. So similarly, if you can try and change the way they speak about themselves, I think that is what creates sustainable change.
Oh, that is really deep, ma'am. There's deep psychology and understanding of human behavior that you just mentioned there, because it comes from self-worth.
Yeah,
And that is, if you think you're worthy, you're going to do it. You're
yeah,
going to do what's right for you, for
yeah.
sure. Why do most people know what's healthy but still struggles to follow it?
It's hard, isn't it? It's really hard to keep, to sustain. It's fine for a couple of days or, a couple of weeks, but if you need to do it lifelong, it's not the easiest thing to do. Going to the gym on a regular basis or exercising in whatever way you can on a regular basis, eating healthy on a regular basis, staying the course is not easy. It's so much easier to just pop a pill. So behavioral change is definitely not easy, and especially today with the number of choices that we have. We are exposed to so much in terms of diversity of cuisine. Advice about exercise. You have so many different kinds of exercise. What does a person follow? They're confused. A lot of the time, they're confused. So I think that also adds to the fact that they're not able to sustain because they keep jumping from one thing to the other. They don't find results, or they find the results and then they fall off and then they come right back. So then it becomes this vicious cycle of yo-yo dieting or intense exercising and then falling off the wagon. So it's not an easy thing to do, which is why I think it's important for lifestyle medicine physicians to actually give prescriptions that are science-based. So that you can form, that can be your foundation. And of course, you can experiment with different things as women get fitter, for instance. What I find is that they like to explore other avenues of fitness. They like to try different things, which is fine. It's more fun. You want to go and join a Zumba class or
Karate.
whatever. Yeah, karate,
Yeah.
whatever it is.
Yeah.
And that's great. But the foundations have to be laid where they don't injure themselves, doing
Right.
mad things. So, yeah.
True, ma'am. And the way you said that it is a spiritual as well as environmental thing. And if
Yeah.
that goes
Yeah.
along, I believe that it would be a long-lasting thing rather than a very short-term, short-lived thing. So
Yeah.
thank you so much, ma'am. Moving on to the next segment with Dr. Pranjali.
Thank you, Kavita. So, my next segment is about women's health and reality check. So we see, ma'am, obesity, PCOD, burnout, they're increasing. Even in medical professional female physicians, we are seeing it is increasing. So what could be the reason why it is increasing so sharply?
Yeah. Well, one reason is definitely lifestyle. Because, like I said, we do not. First of all, we do not move as much as we should.
Yes.
Like starting from childhood. When I think back at my childhood, which was, a long time ago, the amount we played and moved and were outdoors is just incomparable to what people are doing today, the kids are doing today. There's no space. right? And the roads are not safe, they're not comfortable to walk in. So movement has decreased considerably. The food, the choices have increased, the calorific value, the taste value, everything has increased. And of course, there are other substances that are available. And then you have this whole social media, which connects us, like, the internet is great, like what we are doing right now, but it also has its negatives, where there are influencers who give you all kinds of advice, which is not necessarily science based.
Yes. Yeah.
So I think that's one of the reasons that women we are gaining weight, moving less. There's hormonal disruption, endocrine disruptors across the board. There's a lot of stress. I think that's one of the main reasons. There's a lot of stress, which is not being managed properly. It's not that stress should not exist, but it's not being managed properly because there's just so much going on. I don't think there's time to manage stress. You're just moving from one thing to the other. So all of these things can contribute to our state of health today, especially for women.
Yes, ma'am. And then, ma'am, we also see that we discuss a lot of time about the health issues, but we have seen that women's are not taking action also.
Yeah.
We know that we are not doing this. We have a lot of stress, burnout is there. Even medical professionals, we discuss, but action is not taken. So how can we shift this mindset? So we would like to have tips like how
Good
can
question.
Yes.
I wish I had the answer. It's really hard. It's really hard. But I think one of the things I would advise women is, you don't have to be your role doesn't have to be only caregiving. Caregiving is great. You can be a caregiver to your family, near loved ones, etc. But don't fool yourself that you're doing a great service just by being only a caregiver without caring for yourself. Right? That's I think it's a disservice to yourself and to the people around you, because if you don't care for yourself, you're going to be sick and you're going to be unwell, not of the optimum frame of mind. So you're not going to be giving the best care possible. And you're certainly not going to be influencing your children in the right way. So we need to move from that mindset of, I'm the sacrificing person, only looking after my children, and then wait for the children to leave home, which is usually around the 40s. And then they wake up and they say, we've gained 10 kilos in the last 5 years, and, we have XYZ disease and we need to do something about it. We need to start young, taking care of ourselves. How to change the mindset is, I think the younger generation today, I don't know if I'm wrong, but the younger generation today that is the current generation, young generation, seem to be a little more aware and a little more focused on how can I take care of myself.
Yes, yes.
Which is a good thing, provided it's well balanced.
Yes, so I think we see the issues when we have younger patients with PCOD, and also they will come, we want to take action. But when we see 30s, 40s plus patients, they will be, they will not be taking action on time. They will just on discussing, but they taking the action now. I would like to have one key health advice for women in their 30s, 40s, and beyond. So what would you like to give us the advice?
I think it should be something as simple as pay attention to yourself and be mindful. There is no one health modality that will serve everybody, right? Because everybody needs something different. It has to be personalized. But if you just pay attention to yourself, listen to your own body, listen to your mind, learn metacognition, where you're thinking about your thoughts, understanding where you're coming from, that would go a long way. There's a lot of, women on autopilot, not just women, generally, everybody's on autopilot. You just do one thing after the other. You don't think about it. You don't stop and not just not experience it, but you don't really think about it. So if we do that, if we could stop being on that autopilot mode, it would help all of us. It would help all of
So
us.
I think
I
taking,
understand. I understand the socialization. We are socialized to be a good daughter, a good wife, a good daughter-in-law. I understand that, but we can be those things, right? We can to the best of our ability, but you don't need to give up yourself in the bargain.
yes, exactly, ma'am. That's really nice. Ma'am, the last question is when we say mindfulness or you need to reflect. So many
Yeah,
of times when we advise or when somebody tells me you do that, most of the times I'm clueless.
yeah,
How to do that actually?
yeah.
Like you should write down or is there anything, how can you connect?
Yeah, journaling is a great way to do it. Journaling is a great way because when you write down, and it's been shown that when you actually write, with on paper with your not just type,
Yeah.
the neural connections are better formed, and it also acts as a form of catharsis. And you write down your thoughts, the emotions, as you recognize them, and then what you do as a result, right?
Mm-hmm.
So that's what CBT teaches, the ABC model, the
Yes.
antecedent event, the belief, the consequence. So when you do that on a repeated basis, regular basis, you'll start to see patterns in your own thinking process, for instance,
Okay.
right? And being in the moment, mindful is nothing but just being in the present moment, like we all are right now, right? We are just here because we can't. Of course, I'm listening to my dog bark as well. 1 year is there because she's barking, but we are so present because we are enjoying what we're doing. We
Yes.
we like talking to each other, and this is a really energetic, energized conversation. So that kind of presence in whatever we do, most of the time, of course, there is mind wandering, and you do sort of
Yeah.
switch
Yeah.
off and all of that, but most of the time, it's just about being there without judging ourselves all the time. The negative self-talk that goes on in the head, that narrative at the back of the head. So when we do that, we are also able to then observe, okay, what are our thoughts, what are our emotions, and then how are we behaving? And that's all it is. That's all it is. Mindfulness practices like, simple practices like body scans, mindfulness meditation, even just breathing practices.
Mhm.
Depending on who the person is, like meditation per se may not speak to you. Actually sitting cross-legged with incense, that may not speak to you. But other forms of meditation, like for instance, I would think just going out for a walk in nature is meditation for me, right? So whatever speaks to you, just enjoying that moment, being there, present. That's all it is.
Like
That's
talking
all.
to my pets, that is like a therapy for me.
I'm
I
sure.
just go and talk to them. I don't know, but that's.
Yeah.
Thank you so much,
Sure.
ma'am, for your inputs. And over to you,
Thank
Dr.
you.
Ritu, for the next segment. Please.
Thank you so much. There is so much that I can resonate with you, Dr. Sheela, because I was just seeing on social media one of the reels that was actually talking about women and meditation, and it's a really funny one. It just came to me as a forward, but it spoke volumes. Where they showed different women meditating in one single class. And then, each one of them had thoughts going on. So, one talking about, okay, what about the chores, about the tiffin? What about the ironing of clothes? What about the maids? What about the work?
Yeah.
And that definitely showed that, though all of them were actually in one class, none
Yeah.
of them was really present in that moment. And
Yeah.
I believe that, somewhere like you just said, we're all so tuned in, so wired, that we are supposed to be the caregivers, that we forget that we are human at the first.
Mm-hmm.
We all come into this world as a single human being. We play our role, and that's when like we depart also singly. It's not that you go away with any of your assets or relations or any of the other human beings. And like you said, I really love it, reiterating that unless you're the best of yourself, what is there to give? It's all about give, right? And even the theme this year for Women's Day was give to gain. So if you really want to give the best of yourself, at least be the best of yourself. And again, one more thing that you just spoke, I'm just again reiterating the fact, because sometimes I think journaling and also the fact about things that we talk to patients, sometimes it's very difficult to follow ourselves as well. So
Right.
I always think that, when I'm telling the patient, hey, look, you should eat on time. And then I look at myself because I know that I don't eat on time. Sometimes because of pressures at home, work, children, whatsoever. And
Yeah.
that is really a time check for ourselves that, are we practicing what we are preaching?
Yeah.
So definitely, yes, a lot needs to be done in terms of motivating yourself to be
Yeah.
there. So
Yeah.
with so with that, I think I'll definitely take you as an icon and try to fix those things that are really pending at my end.
Ritu,
So
I always say in lifestyle medicine is probably the only field where we have to practice what we preach. We
yeah,
can't tell
absolutely.
patients to do something which we are not
True, true,
preaching. At least we should be trying. I mean, I'm not saying 100%, right? As an obstetrician, I don't need to have a baby to go and deliver a baby.
true,
As a
absolutely.
cardiologist, they don't need to have an MI to go and treat an MI. But LM
Mm,
in lifestyle medicine, you really do need to feel and experience the struggles of behavioral change because it is
absolutely.
challenging. It is very challenging.
Absolutely. Absolutely. And it does, it of course it does resonate from inside. So when you practice a particular thing and then you tell the patients to do it, the kind of passion which you're
Yes,
transferring through your dialogue is also multitude different as compared to what you were doing when you weren't practicing it. So I
yes,
guess that is also the change that happens again, the CBT helps and the
yes.
behavioral change that comes in within you when you're talking. And I think patients can read it in your body
Oh,
language,
definitely,
in
definitely,
your the way you're putting it across.
definitely. Yeah,
And
yeah.
I'm just remembering one fun moment. So whenever I tell my patients that, what, don't eat junk, my husband is looking at me. Yes. That starts with you. So I'm a food lover. So for me to be a North Indian and shift from my parathas to healthy breakfast itself has been a very big struggle. So I completely acknowledge your fact that, yes, you need to make the change first. And then, of
Yeah,
course, it's going to be difficult, but your trial and efforts is what makes the difference.
yeah.
Okay, so jumping into my segment, which talks about action, impact, and future. We already heard some points from you, but just having a little bit of more stern perspective from you, that
Mm.
when it comes to patients, they look at prescriptions. Of course, yes, we need to change when we make our prescriptions more lifestyle medicine friendly, but we as doctors, there is some clinical inertia that comes in when we even write, glucose monitoring. So leave aside, exercise and diet, that usually goes as a verbal dictum. So when you look upon this statement that lifestyle medicine is crucial, it usually goes as an overstatement. So how do you want us, or how do you stand by it, and how would you want the audience also to learn from you?
You mean how do I prescribe it?
How do you prescribe it? How do you, have conviction to pass
Okay.
it on to the patient that why diet and lifestyle is going
Yeah.
to be more important or equally important to the medicines that you're actually getting as a
Yeah.
list?
Yeah, so I was doing it in two different ways. One is if the patient comes for specifically a gynec consult or an obstetric consult, they
Mm.
don't have time to listen to your stories about exercise, diet, and all of that. They're not going to be
True.
focused on that
Absolutely.
because they come with a problem. So you
Yes.
just introduce it as something for the future conversations, right? You don't dump it on them right at the start because they may get overwhelmed because they've come for a problem. So sort out that problem first. But you do need to introduce it and just say, look, there are other things that can help. And
Mm.
a lifestyle medicine consult, on the other hand, is a separate consult that lasts at least 60 to 90 minutes because it's very extensive history taking, going back to, even going back to childhood experiences because that has an impact on how they behave now and why
Right.
they have certain patterns that are recurring in their lives. So it's a really long, mine at least is a really long consult after a really long questionnaire, followed by a prescription that covers diet, exercise, sleep, some modalities of stress management, which will
Mm.
probably initially just be mentioned because everything can't be covered again in the first consult. And then if the patient is willing to come back, which they most often are, to come back and learn along the way, or even join programs like 12 or 10-week programs where you can
Mm-hmm.
handhold them
Right,
through behavioral
right.
change, because it's not possible to do it in one consult. It's just not.
Yeah, yeah, that's so true. Yeah, that's
Yeah.
so true.
Not.
I
So it's a
completely
much
agree.
longer consult, and it's not something that I don't think it's easily included or incorporated in its entirety in a specialist's consultation. So
Right.
I think it needs to be introduced as a concept and with conviction, because you need to really
Yeah.
believe it in order for you to tell the patient, and then have them come back for a more extensive explanation.
Wonderful. So maybe, I can just summarize it as, first, of course, I like the way you said, sort out the problem because
Mhm.
that's what they're here for. So unless you
Exactly.
give them what they're talking about, what
Yeah.
they've come to you, what has brought them to you, obviously they will not have attention of yours. And then, of course, subtly, do tell them about
Yes.
this because, of course, your conviction is there. So that speaks volumes about how that is going to be relevant for them and their problem sorting out over a longer period of time.
Yeah.
And then, of course, yes, so you said it right. Sometimes people may hear it and go from you that, okay, I want to do a diet and I want to do an exercise, but what do we do about it? That's
Yeah.
something that has to follow
Follow
rather
up.
than, trying to close it on that and on that note itself. Wonderful. That brings me to the next question, which is, again, like you said, it's a behavior change, because sometimes, say for example, if they've come to a doctor and they know we've seen this a lot of times in diabetes consultations, that patients, when they're going to come to us, that 15 days before, when they're going to test themselves, they'll be absolutely perfect on their meals, they'll be perfect on their timings of food and everything, so that their readings are manipulated, or they know that they put their best foot forward before they reach the doctor, so that they're not seen in poor light. But that's where this entire LM changes, because LM is not something you can manipulate. It
Mhm.
cannot bring in change in a day or 15 days. That has to be something which you're practicing over a period of time, and that's what then shows up as a result. So how do we impact on the patient's psychology? How do you change the mindset? For example, a patient sitting in front of me and saying, "No, I'm too busy. I'm in a corporate lifestyle, madam. I have no time to walk." Or a homemaker telling us, which is again, I'm very sure common with our audience and all my founders, that I do all the household work and I go miles and miles to get vegetables. I have no time to exercise, madam. I do a lot. So
Yeah.
how do we address these kind of people? What is your first take on, or the way you introduce this to them?
Yeah. So in lifestyle medicine, we have what is called as the trans-theoretical model of change, where
Okay.
you actually assess at which point is this patient. Is she
Mm-hmm.
in the stage where which is called the pre-contemplation stage, where she's not even thinking about it, like you explained. Now, there's no point introducing something to her at this point because she's not going to be impressed. Then there is this contemplation stage. At the pre-contemplation stage, you could probably just say something like, that lifestyle medicine, lifestyle modalities can help, and leave it at that. Just increase
Mm-hmm.
her level of consciousness about it. That's it. No, there's no
Right.
point forcing the issue. Then you have the contemplation phase where probably they're thinking about it. Maybe they have a gym membership, but they haven't gone. They bought their shoes, but they haven't really worked out. They bought some vegetables, but they haven't really been. So that's the contemplation stage. And that's where you can also influence them and
Mm-hmm.
say
Mm-hmm.
that, we can take this further. I can give you some help on how to start implementing the
Right.
changes that you want to implement. So you have to match the patient's stage with what you are going to introduce. If introduced too early, they could become overwhelmed again and not
Yes.
and be put off, right?
Mm.
If they're already in the preparation stage where they're already getting ready, all you need to do is slightly nudge them slightly, right,
Right.
in the right
Right.
direction. Give them the right tools. Give them a few tips and skills, so then they are better equipped to take their journey forward. So you have to match their stage of
Mm.
change with what you are prescribing for them.
Wonderful. I think you beautifully put it out there, because now suddenly it seems, oh my God, this
Yeah,
was so easy. But then, yeah, that's
you
what is. LM all about that. The more we learn, there's so much to actually apply in our practice as well. Thank you so much. With that last question, Dr. Sheela, would be that how do you see lifestyle medicine evolving over the next future 10 years in India? What do you?
I think it's the future of medicine. I hope and I think that it's the future of medicine because I see a lot of young doctors wanting to, if not do a complete LM practice, at least introduce it into their practice. And more than the doctors, I see the lay people wanting scientific, evidence-based advice. So I
Yes.
do think it is the future. It's definitely going to play a very important role, especially because of the global organizations that are already
Yes.
present,
Mm.
and they are becoming much stronger. So I
Mm.
think it has a huge role to play, and I'm happy for that. I'm really happy for that.
Truly, it's very very I don't know. It's a big privilege for us because looking at the current situation, ma'am, when the diabetes is increasing, PCOS is increasing, younger generations are getting involved. We have more people who are at the clinics as compared to healthy
Yeah,
counterparts. So I
yeah.
guess definitely yes, LM is the yes for the future. So with that, thank you so much for the lovely answers and the
Thank you.
motivating ones. Let me pass on the baton to Dr. Rukia for the next segment.
It's been so wonderful to hear from you. And also, I think, the beauty that you get is how you simplify things. It's like, don't bombard the patient with all the knowledge that you have on day one and just handhold them and step by step, just make them that it's doable, it's manageable. So, assessing that what is your stage, where you are mentally to probably accept it and then go forward from there. It can be from pre-contemplation to execution at any part. uh, my segment is the audience ask. So here we have been giving our this live segment that is going, and we have the delegates who put up the questions on live. And the questions that I have for you is, if there's one habit every woman here should start from tomorrow for better health, what would it be?
As I mentioned earlier, I think stopping the autopilot and getting on board with paying attention to yourself and your needs, I think that's really important. But having said that, another really important habit that every woman should incorporate is strength training
Okay.
because it's a game changer as far as weight, as far as metabolism, as far as mental health, everything is concerned. So I think strength training is something that not all women are comfortable with, or they've not been exposed to it, or they have a lot of misconceptions about it. But I would think that strength training is extremely important. If you haven't incorporated it already into your fitness routine, then that's something that one must do.
I'm sure, yes, being mindful, but strength training. So, girls here, everyone who doesn't have, are not doing it, please make sure that you all are doing the strength training as advised. And it takes a long way. I just don't think of it because I love my workouts. I don't like, I feel I've not done my day if I've not gone for my workouts. So, that just makes me, like you said, it's your narrative. So it's a part of my narrative when I'm introducing myself. So it's gone to that level that, if I miss it, I feel bad about it. It has changed, it changes you in many ways, in the way you think, your posture improves. And, overall, your health does make a difference. So, ma'am, again, in that context, we have GLP-1 agonists, which are right there, and right from the original molecules, the peptides, to now even the generic molecules which are there. So, how do you see? How do we balance this lifestyle interventions with medications like GLP-1 in the real world practice?
Yeah. So I do think that there is a role for the GLP-1s. I do think so because there are some people who find it extremely difficult, especially to lose that initial weight. I think it has a very important role, but I think the mistake that's being made is that the lifestyle modalities are not being emphasized simultaneously. It's not like you lose the weight and then start lifestyle. You got to do it simultaneously, because we know that when there is extreme and rapid weight loss, there is a lot of muscle loss that's also happening. And that is hugely detrimental, especially for the Indian woman, because we're already sarcopenic. We're already born with very low muscle mass, more fat percentage. So if you're dropping muscle even more, that's not going to hold us in good stead, especially with age, menopause, osteoporosis, etc. So if we can also simultaneously talk to patients about implementing exercise, especially strength training, eating the right kind of food, enough of protein to maintain the strength training, that would go a long way, because then we can think of tapering them off, because otherwise this is like a lifelong drug. So if you want to taper off, I think the lifestyle has to fall into place very, very, very well. So I think that is the main issue. That it's not that it's not important and you shouldn't give it, but diabetologists like yourselves, I'm sure, are already doing it, but not everybody is. So, most people are just giving the GLP-1s and not going any further. In fact, there was a client of mine who was on the lifestyle path, and she, who was doing quite well, and then opted to start GLP-1s. But when she started that, she stopped the lifestyle modalities. She stopped the exercise. She stopped because she was losing weight anyway. So that's the I think that's the part that the physician has to emphasize, because they're coming to the physician. So patients will believe you and will respect what you're saying. So strength training is of utmost importance, especially with GLP-1s.
Absolutely, ma'am. So do not. So this drug, which is greatly useful, it is also getting abused at the same time. So that is one thing that we should be mindful about. And yes, lifestyle is the core. Lifestyle management is the core of any weight loss journey, or healthy eating habits. So yes, one should not forget that while you are also taking support of GLP-1 molecules, while your body is resetting, you know. So now with this, the audience ask is over, and we come to the last segment of this, which is the rapid fire. And it's time to switch gear, where we lighten it up with a signature white pulse. A few quick answers which are instinctive and honest. So are we ready for it?
Yeah, I hope so.
Okay. So the first question, yeah, I didn't know you were going to mention about it, but the question was cardio or strength training.
Well, it depends, but I would go with strength training.
Fantastic. So, ma'am, diet or exercise, which matters more?
As far as weight is concerned, the diet is more important. Diet is a bigger lever for weight. But as far as mental health, well-being, a sense of self-efficacy, self-esteem, exercise is better.
Fantastic. Ma'am, discipline or motivation?
Both, because you see, motivation gets you started, but it's discipline that keeps you going. You can't be motivated every single day. Sometimes you're just not motivated at all, but you still need to get to do what you're doing. So you need the motivation to start, but you need discipline to continue.
It's the discipline which makes you run longer. Yoga or gym?
Both again, but depends on what you're looking for. Yoga is more for flexibility and and of course mindfulness and the whole calming. And the gym is to I'm assuming you mean strength training by gym. That's to build muscle, strength as well as mass. You need both, yeah.
Morning routine or night routine?
Morning's always better. You get it out of the way. Otherwise, your day you never know how the day goes, right?
Prevention or cure?
Sorry, I didn't hear you.
Cure.
Prevention any day. Yeah, prevention. But if you do get something, lifestyle does play an important role if you do get a chronic disease.
Right. Ma'am, weight loss injection drugs, are they magic or
I think you're breaking up. I can't quite hear you.
Weight loss injections, are they magic or misunderstood?
They're not magic, but they do produce very good results, except that they need to be prescribed with the right complements. That is lifestyle modality.
Fantastic. And ma'am, last question for Dr. Sheela Nambiar. Dr. Sheela Nambiar, tea or coffee for you?
For me, coffee. I love coffee. Yeah.
Right. Fantastic, ma'am. This was also very instinctive, honest, and just so rapid as we wanted. Thank you so much for being here. Over to you, Dr. Lotika, for your.
So thank you so much, Dr. Sheila. It's really been so insightful. We've all learned so much from you, and I've taken home a lot of insights from today's talk. How stress should be managed, and though we need some stress in our life, but we should learn how to manage it, and we need to start taking care of ourselves. Pay attention to what our body is saying to us, and of course the importance of strength training. I personally started strength training, I think 2 3 years ago, after watching you do the demo on one of our virtual conferences. And yeah, it's been really a game changer, so to say. So now I'll ask Dr. Pranjali what is her takeaway from here.
So I think every statement was a takeaway. Whatever ma'am was telling, I
True.
was just listening to her. But the main thing is non-judgmental listening to yourself. So even
Yeah.
if you get negative thought or something, you just listen to it, understand, and journal writing. So that is I
Yeah.
always remember from ma'am. Kavita.
Hmm.
So, like what Dr. Pratili was saying, I learned so much from everything that you were saying. Every dialogue, every statement was like connecting back to reality, like a reality check. But like when you said be aware of your needs, stop autopilot. I love that. I love that aspect, and I love how self-aware it makes oneself and pushes you to do better, do better. It's like a continuous process, as you mentioned. It's a long-term effort, and you cannot give up midway and say, okay, let's just, whether it be GLP-1s or it be exercise, it's a self-awareness is most important. And the other thing you mentioned was don't be a caregiver without giving care to yourself. So that comes back to the same thing. But thank you so much for your insights, ma'am. Dr. Rokia.
Ma'am, many things, but what I really liked is you changed the narrative to make it sustainable. I think only when that it goes deep down there that you can sustain it in a longer way. And of course, being pay attention to yourself and being mindful. And as you also mentioned, Kavita, our role cannot just be about caregiving and while you are not taking care of yourself. So you need to take care of yourself while we are all caregivers here. So fantastic, ma'am. It's been great learning from you. Wonderful to talk to you.
Thank you.
Yeah.
Oh,
And Ritu,
I
Dr.
think
Ritu, yeah.
I think I just realized there's one more question that we've got. One, of course, Chitra and Megha send us congratulations because they love to talk to Sheila on the show. And there's Dr. Shobha who's asked that we see so many ads for anti-aging creams which are very confusing and they're sometimes very expensive as well. So any few tips on how you would, judge these creams and ensure that your skin health is good?
I'll tell you one thing. If there is one pill that you can call anti-aging, it is exercise.
I love
Honestly,
that,
it
man.
is. It
Truly
is.
love
It
that.
is exercise. Yeah, it's no cream can compare. I'm not an expert on anti-aging cream, so I wouldn't know. But a good moisturizer is, frankly, all that you require, in my opinion.
Totally. Thank you so much. I think with that, I will just say that a lot of things to take away. Already, everybody has said so many things about what they learned from you. I guess I'm definitely gonna hear the entire episode all over again so that I haven't missed much. But what connected with me the most was that, of course, the conviction that has to be there within you. You sort out the problem, because we are again getting back to patient at the center. The ultimate part is, of course, you look at yourself first, because you're the one who's going to make the change, to make the impact. And then the second thing is, when you are treating a patient, the patient, of course, comes first. So I think that is what resonated with me the most, alongside
Yeah.
others.
Yeah, that's important to keep the patient at the center of it, as well as on the other side to keep yourself at the center of the care
Yes.
and see to it that you are able to look after yourself, because if you are able to look after yourself, you can look after a lot more, not just your family, friends, your patients as well. So this is really has been very nice. And madam, any quote that you swear by, or what is your inspirational quote, if you could share?
I think the one that really most inspired me was that one by Thomas Alva Edison, the
Mm-hmm.
doctor of the future. That really did change my life. So
Oh,
the trajectory of my practice, my personal life as well. Um, and I'll go with that. Yeah, I'll go with that. Yeah.
okay. That is so nice. So we end with the signature vibe. If you can put your hands together, both your fingers together, and we say at the count of three, we say be the vibe. So one, two, three, be the vibe.
Be the
Bye.
one.
The vibe. Yeah. So thank you so
Thank you,
much,
ma'am.
So
madam.
much for having
Thank
me.
It's
you.
been so
Thank
Thank
nice
you
to
so
you.
have
much.
you with us. It
Thank
has been
you.
really
Ma'am, is
inspiring.
So
your
much
pet
fun.
around?
Sorry?
Pardon?
Is your pet around?
Yeah, she's